Hi, good afternoon, everyone. Today I will be doing a presentation on a project. Bear with me a moment, and it is for the Beyond the Bedside How CMS is Reshaping Workplace Safety in Healthcare. And okay, in regards to my project, I'm going to talk about the CMS workplace violence prevention requirements that came out in 2022. CMS updated these expectations because workplace violence in healthcare has been rising for years, especially in emergency and behavioral health settings. What CMS basically said is that safety isn't optional anymore, it's part of the conditions of participations. So hospitals have to show they're protecting both staff and patients if they want to stay eligible for Medicare and Medicaid. From an HR perspective, this regulation touches training, staffing, documentation, and overall safety culture. It really sets the tone for how organizations need to approach workplace safety expectations going forward. And of course, here in this slide, we will be talking about the overview of CMS QSO 2304. This memo lays out what CMS expects hospitals to do to prevent identity and respond to workplace violence. It's not enough to react after something happens. CMS wants hospitals to show they're actively preventing incidents. Surveyors now look at policies, training, reporting systems, and follow up actions. CMS also connects staff safety to patient safety, which makes sense because when staff don't feel safe, it affects morale, care quality, and retention. So, this memo really shifts workplace violence from being a security issue to a compliance requirement. It's a big chance in how hospitals approach CMS compliance expectations. Key requirements: CMS outlines several requirements hospitals must meet. They need a written workplace violence prevention program that's updated regularly. All staff must receive annual training, and new hires need orientation training before they start working with patients. Hospitals also need a system for reporting and tracking incidents so they can identify patterns and risks. Environmental assessments are required to spot hazards like unsecured equipment or blind spots. And after any incident, hospitals must take corrective action and document what they did. These steps create a structured approach to violence prevention programs instead of just reacting. And in this next slide, we talk about HR responsibilities. HR plays a huge role in meeting these requirements. HR updates policies, coordinates training, and makes sure staff complete their competencies. Documentation is a big part of CMS surveys, so HR has to keep everything accurate and organized. Staffing is another major piece. HR works with leadership to ensure units are staffed in a way that reduces risk. After incidents, HR handles employee relations, workers' comp, and leave. HR also collaborates with security, nursing, and risk management to keep organization compliant. So HR is really at the center of compliance of responsibilities. And then on the next slide, we talk about interaction with other laws. Here, this regulation lines up with OSHA's general duty clause, which requires employers to provide a workplace free from recognized hazards. It also overlaps with Joint Commission standards that went into effect in 2022. Some states, like California, have their own workplace violence laws that are even stricter. There aren't direct conflicts, but hospitals must juggle multiple layers of regulation. HR has to make sure policies meet all requirements at the same time, which can be challenging. This is where understanding regulatory alignment becomes important here. On the next slide, we are talking about organizations affected. These requirements apply to all hospitals that participate in Medicare or Medicaid. That includes acute care hospitals, critical access hospitals, psychiatric units, and emergency departments. Large systems may have more resources, but they also have more complexity across multiple campuses. Smaller or rural hospitals may struggle with staffing and training resources, but they're still held to the same level standards. So the expectations are universal, even if the challenges look different depending on the organization. This is a good example of how hospital size compliance fits all. Next up, we have penalties for noncompliance. CMS can issue citations if hospitals don't meet these requirements. They may require corrective action plans and follow up inspections. The biggest penalty is losing Medicare or Medicaid participation, which can financially devastate a hospital. OSHA can also issue fines if they find unsafe conditions, and poor compliance increases liability in lawsuits, especially if documentation is weak. So the stakes are high for getting this right. Understanding compliance penalties is a big part of why HR needs to stay on top of this. Next up, we have patient challenges. For patients, these requirements can mean more security measures like screening or restricted access. Violent incidents can cause delays in care or create a stressful environment. Some patients may feel anxious if they witness aggression or see staff responding to incidents. Hospitals have to balance safety with maintaining a positive patient experience. So while the regulation is focused on staff safety, it definitely affects patients too. This ties into a broader patient safety impacts. And then next up, we have the HR and staff's challenges. HR faces challenges like coordinating training for all employees, managing turnover, and ensuring adequate staffing for staff may experience trauma or burnout after violent incidents. HR also investigates incidents, manages workers' comp claims, and supports employees who need leave or accommodations. During CMS surveys, HR must show complete documentation, which adds pressure. So HR is juggling compliance, safety, and employee well-being all at once. These are real HR operational challenges that organizations have to plan for accordingly. And lastly, we have the legal documentation implications. Documentation is a major part of compliance. Incident reports, training records, and staffing logs will all become evidence during CMS surveys. If documentation is incomplete or inconsistent, it can suggest negligence. Strong documentation protects the organization and supports fair HR decisions. It also reduces liability and helps show the hospital took appropriate action. This is why understanding legal documentation standards is important in healthcare. Overall, the CMS workplace violence prevention requirements really reinforce that safety is a core part of healthcare compliance, not just an operational issue. These standards push hospitals to be proactive, consistent, and accountable in how they protect both staff and patients. HR plays a major role in making sure policies, training, staffing, and documentation all line up with CMS expectations. So, this regulation is shaping how organizations approach workplace safety moving forward, and it highlights why strong HR processes are essential for compliance. And this has been my presentation today. Thank you so much for listening, and I hope you have a wonderful rest of your day. Thank you.